Good afternoon, everyone. We're here with our team, Healing Hearts. We're presenting our PowerPoint presentation for Sentinel event. It's the wrong patient, wrong surgery. Here we have Lindsay Friel, Carla Ochoa, Juanita Morelos, Brittany Wilson, Jackie Rodriguez Cortez, and myself, Monica Vidal. For the Sentinel event, we have a medical error leads to permanent serious harm or death to a patient. In this slide, we will talk about contributing factors, preventative measures, and real-life incidents.
Okay, the procedures that there are, sorry. There are many policies and procedures that are supposed to take place before a surgical procedure. These include standardized patient identification, preoperative verification process, making or marking the surgical site, preoperative timeout, effective communication, education, and training. Using at least 2 patient identifiers, for example, name and date of birth. Make sure the wristbands or identification documents are accurate and legible. Have the surgical site marked by the surgeon performing the procedure, involving the patient whenever possible.
So there are many contributing factors to this. So inadequate staffing is one of them, technical failures and equipment errors, lack of leadership, like in our video, the DON at the moment, she just decided to throw anyone behind check-in. So that, and then communication breakdown, and then inadequate patient identification.
So, excuse me, for preventative measures, adequate staff is crucial and necessary at all times. Whether being in an inpatient or outpatient setting, we should have an operating room manager and a preoperative nurse who handles the leadership roles in a professional and safe manner. Medical errors can occur when equipment fails. You must ensure your facility has health IT specialists on board to build, implement, or support electronic health records and other systems that store patient-related data. One of the best preventative measures taken is having all patients use medical alert bracelets. These wristbands include some of the following that is very important to know, such as the patient's first and last name, the date of birth, and the medical record number.
So when you look into how a patient or a victim is affected, you can see they can go through grief from losing a limb or even grieving the life that they could have had. It can lead to depression, anxiety, PTSD. We have physical harm that can lead to like medication dependence, sometimes loss of confidence as well. That can affect their quality of life, maybe even being too self-conscious to start or build relationships that they have had. Loss of trust in the healthcare. They can refuse to go seek medical care in the future. We also can look at them, their financial things, whether they choose to sue or even the financial burden of treatment itself, depending on how they were affected. If you go on to the next one. And then we have the effects on the provider. There is something called the second victim phenomenon, which is how the person who made the mistake is impacted. So we have the emotional, like the guilt, the stress, they feel incompetent. They can have anxiety to do procedures in the future. All of this can spill into their personal life. This can affect their relationships. They can be isolated. Of course, there are professional repercussions, though they can even lose their jobs. It can affect their reputation to get other jobs. We can see how the dynamic will be affected. Communication get worse. There's less trust. And of course, there is the legal consequences, draining them financially as well.
So the legal aspect In this case, you would secure the situations and the safety of anyone directly involved. Medical equipment involved, you immediately take it out of service and label it under investigation, disclose situational relevant info to the patient as soon as possible, provide support to family and staff, report to CDPH no later than 5 days of occurrence. After reporting, courts will review and take further action regarding the incident. It may result in being sued or facing jail time. If you do not report within 5 days of the deadline, legal implications may be carried out. And then there's a joint commission, which is a foundation that adopted the Sentinel event policy in 1996. This policy is an optional resource to help improve safety and learn from these events.
Okay, statistics. Mortality rates from patient surgery can have a mortality rate of 7.7%. Premature injuries, wrong patient surgery can have a permanent injury rate of 26.9%. Liability payments can result in a mean liability payment of 109,648. Frequency, one study estimates that the type of error occurs in about 1 in 112,000 procedures. A hospital might experience one error every 5 to 10 years. And then here are some live events. In the University Hospital of Cleveland, 2021, there was an incident where a kidney was transported into the wrong patient. The outcome of the patient who received the kidney was recovering well, but the intended recipient missed the transplant. The hospital placed 2 employees on administrative leave and conducted an investigation. Another incident was on Boca Raton Regional Hospital in 2020. The incident and an interventional radiologist placed in the wrong patient, in the wrong kidney of an 80-year-old patient. Outcome was the mistake involved removing an old stent from the right side and correctly placing a new stent on the left side. The case led to a legal action against the radiologist. The next one would be Maryland, 2009. That incident was in obstetrician college.
The incident involved an obstetrician gynecologist removing the wrong ovary from a woman. The outcome was the results in a 1.42 million malpractice award in 2013. This highlights the significant financial and personal impact of such mistakes.
Okay, thank you so much. And this concludes our presentation. Bye-bye.